There is a hotel in Hong Kong. The building still stands. The lobby still smells of cut flowers and floor polish. The elevators still chime when they reach the 9th floor. And on the 9th floor, at the end of the corridor, there is a door. The brass numbers on it used to read 911. The hotel changed them after 2003. The new number is 913. Tourists still walk down the corridor and ask the front desk for the old room. The staff smile and say it no longer exists. They are lying. The room exists. They just renamed it because the truth was bad for business. The truth is that one man slept in that room for one night, and by the time the sun rose, 16 people on that floor were carrying a virus that would burn through 5 continents in 8 weeks. His name was Liu Jianlun. He was a doctor. He came to attend a wedding. And he is the reason you remember the word SARS. I am Blackwell, and tonight I am going to walk you through 6 doorways. 6 pandemics that the world calls natural disasters. 6 plagues we are taught to blame on bats, birds, monkeys, fate. I have spent the last year inside the archives, the WHO transcripts, the published autopsies of failed public health responses, the autobiographies of the men who saw it coming and could not stop it. And I am here to tell you what every honest epidemiologist will tell you off the record. Viruses do not start pandemics. People do. Every single global outbreak in modern history needed a doorway, and every doorway had a name on it. A railway worker, a commissioner, a scientist, a typo, a doctor, a businessman. 6 humans, 6 decisions, 6 funerals on a planetary scale. Pull the door closed. Stay with me. A railway worker in Bukhara coughed. 4 months later, London was burning with fever. His name does not survive in any record. He worked for the Trans-Caspian pandemic returned in waves through 1893 and 1894, each wave milder than the last, each wave still killing tens of thousands. By the time it burned out, the connection between rail networks and disease propagation had been mathematically proven, written up in monographs in 3 languages, and then, in the typical fashion of human institutions, completely ignored. Here is the irony. The men who built the Trans-Caspian Railway were celebrated as heroes of empire. Their portraits hung in ministries. Schools were named after them. Not one of them was ever held responsible for the fact that the very infrastructure they had built had served as the delivery system for a pandemic that killed 1 million people. The railway worker in Bukhara who coughed first has no monument, no name, no grave we can find. The engineers who created the doorway he walked through have statues. That is how history works. We blame the cough. We never blame the corridor. I have stood in the Bukhara station, what is left of it. The platform is still there, the same length of stone. You can imagine the man on a bench, hand over his mouth, waiting for a train he should never have boarded. He did not know what he was carrying. He did not know that the empire that built the rails was about to ride them into a global tragedy. The doorway opens. The virus walks through. The historians write a paragraph. The next doorway is already being built. Health Commissioner Haven Emerson printed the names and home addresses of 8,900 sick children in the morning papers. He did this in June of 1916. He did this in New York City. He did this on purpose. And he genuinely, sincerely believed he was doing the right thing. Haven Emerson was 42 years old, a Harvard man, a reformer, a believer in what he called modern public health. He had been appointed health commissioner of New York City the year before, and when the polio outbreak began in the Italian immigrant tenements of Brooklyn that summer, he saw it as a chance to apply scientific rigor to a problem that the city had previously left to the chaos of folk medicine and parish priests. He believed that transparency would save lives. He believed that if the public knew exactly which homes contained sick children, They would avoid those homes, and the chain of transmission would break. He had clearly never met the public. The first cases appeared in late June, clustered around Pigtown, a working-class Italian neighborhood in South Brooklyn. By the first week of July, the Department of Health had documented several hundred cases of infantile paralysis. By the second week, several thousand. Emerson made his decision. He ordered the names and street addresses of every confirmed pediatric polio case to be released to the major newspapers. The New York Times printed the lists. The Brooklyn Daily Eagle printed the lists. The Sun and the Tribune followed. 8,900 names with addresses mapped, indexed, available on every newsstand in the 5 boroughs. What happened next was the textbook definition of what public health professionals now call the Streisand effect of containment. Mobs formed outside the listed apartments. Italian families were dragged from their homes by neighbors who feared infection. Police were called to protect children who had committed no crime, other than being born to immigrants in a tenement that had been printed in the morning paper. Doctors documented cases of healthy siblings being beaten by mobs. Landlords evicted families on the spot. The Italian consul filed a formal protest. Catholic priests pleaded for calm from the pulpits. None of it worked. And then the families fled. They fled to relatives in New Jersey. They fled to cousins in Connecticut. They fled to the Jewish enclaves of the Lower East Side because Italians and Jews shared poverty and shared a willingness to take in the running. They carried their sick children with them. They carried their healthy children, who were silent carriers, with them. Within 48 hours of the first list being published, polio cases were being reported in Newark, in Hoboken, in Stamford, in cities the virus had not previously touched. By August, the outbreak had spread up and down the eastern seaboard. By September, it had reached as far west as Pittsburgh. The final tally was 27,000 paralyzed, 6,000 dead. The majority were children under the age of 10. Naomi Rogers, in her 1992 book, Dirt and Disease, published by Rutgers University Press, documented the entire chain of decisions that led from Emerson's transparency policy to the cross-state propagation. Her conclusion, drawn from city health records and contemporary newspaper archives, is unambiguous. The publication of the address lists did not slow the outbreak. It accelerated it. It transformed a contained Brooklyn epidemic into a regional pandemic by triggering precisely the panic flight response that any sociologist could have predicted. Haven Emerson kept his job. He went on to become a celebrated figure in American public health. He taught at Columbia. He was elected president of the American Public Health Association. He died in 1957, full of years and honors, and the obituaries described him as a pioneer of modern epidemiology. None of them mentioned the lists. None of them mentioned the mobs. None of them mentioned the 6,000 small coffins buried in cemeteries from Brooklyn to Pittsburgh. The irony of Haven Emerson is not that he was a villain. He was not. He was a man who believed in data, in transparency, in the public's right to know. The irony is that his belief, applied without an understanding of how human beings actually behave under fear, killed more children than the virus would have killed if he had simply done nothing. The doorway he opened was not a hotel room or a railway carriage. It was the front page of a newspaper. He printed the addresses. The virus read them. The children died. I have walked through Pigtown, what remains of it. Most of the tenements are gone, replaced by housing projects and glass condominiums. But if you stand on the corner of 1st Avenue and 16th Street and you close your eyes, you can almost hear the screaming. Mothers refusing to give up their children, police breaking down doors, the newspapers landing on every stoop with the lists folded inside. 8,900 addresses, 6,000 graves. One commissioner who lived to be 83. Maurice Hilleman read a paragraph in the New York Times and knew millions would die. He was 40 years old, working at Walter Reed Army Medical Center, a virologist whose colleagues considered him brilliant and difficult in roughly equal measure. He drank too much. He swore constantly. He had no patience for committees, and even less for the public health service bureaucrats who, in his opinion, would not recognize a pandemic if one walked into their office and shook their hand. On the morning of April 17, 1957, he sat down at his desk with a cup of coffee and the Morning Times, and on page 3, in a small column, he read about a strange respiratory illness that had broken out in Hong Kong. Several deaths. The Hong Kong health authorities had named it a new strain of influenza A. Most readers would have skimmed past it. Hillman did not skim. He read it twice. He stood up. He walked into his supervisor's office and said, in his standard unsanitized vocabulary, that the world was about to face the worst pandemic since 1918, and that the United States had approximately 5 months to manufacture a vaccine before the virus arrived on American soil. His supervisor looked at him as if he had lost his mind. Hillman had not lost his mind. He had recognized something in the Times paragraph that the public health establishment had missed. The description of the Hong Kong outbreak, the speed, the demographics, the symptom profile, fit a pattern that virologists of his generation had been trained to fear. This was not seasonal flu. This was an antigenic shift, a novel virus, a subtype to which no living human had immunity. He did the math in his head, and the answer was a global death toll in the millions if nothing was done. What happened next is documented in detail in Paul Offit's 2007 biography, Vaccinated. Published by Smithsonian Books, drawn from Hillman's own oral histories and the Walter Reed correspondence files. Hillman demanded virus samples. The Public Health Service told him to wait through proper channels. Hillman bypassed them entirely. He wrote directly to a Navy doctor in Japan, a man named Dr. Vogel, and asked him to obtain throat swabs from sick American servicemen who had contracted the illness in Hong Kong. The samples arrived at Walter Reed in May. By June, Hillman had isolated the virus. By July, he had confirmed it was a true antigenic shift, a new strain he designated H2N2. He sent the samples to the 6 American vaccine manufacturers and personally pleaded with them to begin production immediately on his authority, without waiting for federal approval. 4 of them said yes. 2 of them said they needed to consult their lawyers. The U.S. government did not officially declare the situation a public health emergency until September. By then, the virus was already in California, brought home by sailors and tourists. The first wave hit American schools when classes resumed. Children fell ill by the tens of thousands, hospitals filled. The vaccine that Hillman had pushed into early production saved untold lives, but it arrived after the first wave had already crested. 40 million doses were eventually distributed, an extraordinary achievement for 1957. But the timing was off by precisely the 5 months that Hillman had begged the bureaucracy to give him. The final toll, according to CDC retrospective analyses, was 1.1 million dead worldwide, 116,000 in the United States. Hillman, when interviewed late in his life, said that the death toll could have been cut by a factor of 3 or 4 if the federal response had moved at the speed he was moving. He never quite forgave the Public Health Service. He went on to develop more than 40 vaccines over his career, including the modern measles, mumps, and rubella vaccines that became the MMR shot every child receives. He saved more lives than any single human being in the 20th century. He died in 2005, and the obituaries called him the most successful vaccinologist in history. None of them mentioned that his greatest achievement was the one he had tried and partially failed to deliver, the vaccine that came too late. The irony of Maurice Hillman is the cruelest in this entire gallery. One man saw the pandemic coming. One man, sitting alone with a cup of coffee and a newspaper, identified the threat with nothing but a column inch of wire copy and 3 decades of training. And the system designed to protect public health needed funerals before it would listen. The doorway was not the virus. The doorway was the bureaucracy that took 5 months to do what Hillman had done in 5 minutes. The lesson, written in 116,000 American graves, is that early warnings are useless without the political will to act on them. We have learned this lesson. We have learned it many times. We have not yet learned it enough. A typo turned a flight attendant into the man who brought AIDS to America. His name was Gaetan Dugas. He was a French-Canadian, born in Quebec City in 1953, a steward for Air Canada, conventionally handsome in the way that men of his generation defined the word. Blonde, lean, blue-eyed. The kind of face that gets called charming on 3 continents. He flew long-haul routes. He had what every account from his lifetime describes as a remarkable number of partners, a count he himself estimated at around 250 per year during the late 1970s. He was diagnosed with Kaposi's sarcoma in 1980, one of the first such diagnoses in North America. He died of AIDS-related illness on March 30th, 1984. He was 31 years old. And then, after his death, he became the most hated man in the history of American epidemiology because of a single misread letter. Here is what actually happened, as documented in Richard McKay's 2017 book, Patient Zero and the Making of the AIDS Epidemic, published by the University of Chicago Press, the definitive academic reconstruction of the case. In 1981, the CDC began investigating a cluster of Kaposi's sarcoma cases among gay men in Los Angeles. The investigators, led by Dr. William Darrow, used a standard contact tracing methodology. They interviewed sick patients about their sexual partners. They mapped the connections. They labeled the patients with codes to protect their identities. Dugas, because he was a Canadian patient who had partners in California, was assigned the code Patient O, the letter O, standing for Out of California. It was a geographic designation, nothing more. Then a CC clerk, retyping the cluster diagram for an internal report, misread the letter O as the number 0. Patient 0. The phrase was electric. It implied origin. It implied source. It implied that this one Canadian flight attendant was the index case, the man who had brought the virus to America, the human starting point of the epidemic. The diagram, with its corrupted label, was reproduced in the 1984 cluster study published in the American Journal of Medicine. The phrase Patient Zero entered the lexicon. And then a journalist named Randy Shilts, working on what would become the best-selling book And the Band Played On, took the phrase and built an entire narrative around it. He portrayed Dugas as a sociopathic vector, a man who had been told he was infectious and continued to have unprotected sex out of malice. The book was published in 1987. It was a sensation. It was also, in the central allegation, factually wrong. McKay's reconstruction, drawing on the original CDC interview transcripts, makes clear that Dugas cooperated with investigators, named his partners, allowed his blood to be drawn for research, and at the time of the interviews did not yet understand that the disease was sexually transmissible because nobody understood it. The retroactive demonization of him as a knowing superspreader was a literary invention built on a typo. Genetic studies published in 2016 in the journal Nature by Warabi and colleagues definitively proved that HIV had entered the United States in the early 1970s, years before Dugas had ever flown a route to California. He was not Patient Zero. There was no Patient Zero. The virus had been in America for nearly a decade before he ever felt sick. But the damage was done. By the time the science caught up to the slander, Dugas had been dead for 32 years. His face had appeared on the cover of magazines under headlines that called him the man who gave us AIDS. His grieving family in Quebec received hate mail for decades. The American public, desperate to find a face to blame for an epidemic that the federal government refused to address, had been handed a French-Canadian flight attendant on a silver platter, and they had eaten him alive. President Reagan would not say the word AIDS publicly until 1985, 4 years into the epidemic. By that point, 12,000 Americans were dead. By the end of the decade, over 100,000. Globally, the death toll would eventually exceed 40 million. The irony of the patient zero myth is not subtle. Americans were given the choice between blaming a man and blaming a system. They blamed the man. They blamed him because it was easier. They blamed him because the alternative, blaming an administration that had let an epidemic burn through the gay community for years before acknowledging it existed, was politically unbearable. A typo gave them permission. A clerk's misreading became a national exorcism. The doorway that let HIV into America was not Gaetan Dugas. The doorway was a White House that refused to say the word for 4 years. Patient zero never existed. Patient silence killed millions. I have stood in front of the apartment building in San Francisco where Dugas spent his last weeks. There is no plaque. There is no marker. There is just a doorway, like any other doorway, and a sky above it the same color as every sky. He walked through that door for the last time in March of 1984. He was 31. He was sick. He was scared, and history was already preparing the lie that would outlive him. Dr. Liu Jianlun checked into room 911 of the Metropole Hotel. By morning, the virus was on 5 continents. He was 64 years old, a respected professor of nephrology at Sun Yat-sen University in Guangzhou, in the southern Chinese province of Guangdong. He had spent the previous several weeks treating patients suffering from a strange and aggressive respiratory illness that had been spreading through the hospitals of Guangdong since November of 2002. The Chinese authorities had not yet announced the outbreak to the world. The World Health Organization had heard rumors. Hong Kong had heard rumors. But on February 21st, 2003, when Dr. Liu boarded a bus to Hong Kong to attend his nephew's wedding, no one outside of Guangdong knew that a new coronavirus was circulating in southern China. Dr. Liu knew. He had treated the patients. He himself was beginning to feel ill. He took the bus anyway because his nephew was getting married, because family is family, because he believed his symptoms were mild, because human beings are human beings, and because that is how every pandemic in this list has begun. He checked into the Metropole Hotel in Kowloon that afternoon. He was assigned to room 911 on the 9th floor. The wedding was the following day. By that night, his fever had spiked. He spent the night coughing in his hotel room. The next morning, he attended the wedding briefly, then collapsed and was rushed to Kwonghwa Hospital. He told the admitting doctors, in one of the most quoted single sentences in the history of public health, that he had been treating patients with a very dangerous disease in Guangzhou, and that they should isolate him immediately. They isolated him. It was already too late. The Metropole Hotel, 9th floor, on the night of February 21st, 2003, contained 16 guests in addition to Dr. Liu. 3 of them were a family from Toronto, 2 were businessmen from Singapore, 3 were tourists from Vietnam, several were guests from elsewhere in Asia, the United States, and Europe. They shared the same hallway. They shared the same elevator buttons. They shared the same air conditioning system. According to the WHO consensus document on the epidemiology of SARS, published October 17, 2003, all 16 of these guests contracted the virus during their single, overlapping night with Dr. Liu. They then flew home. Within 72 hours, SARS cases were being reported in Hanoi, Singapore, Toronto, and the city of Hong Kong itself. Within 2 weeks. Cases were being reported on 5 continents. The 9th floor of the Metropole Hotel had become the most consequential corridor in 21st century epidemiology. Dr. Liu died on March 4, 2003, in isolation, never having seen his family again. Before he died, he gave investigators the full clinical picture of the disease he had been treating in Guangzhou. He named the hospitals. He named the wards. He told them everything he knew. The information he provided in his last days of life is the foundation on which the global SARS response was built. He saved an unknowable number of lives by speaking. He had also, by traveling while symptomatic, started the global outbreak that those lives needed saving from. Both things are true. Both things define him. The final toll of the SARS epidemic was 8,098 cases, 774 deaths, and an estimated $40 billion in economic losses across Asia. The number seems small now, by the standards of the pandemic that would come 17 years later from the same family of viruses, in the same country, through similar pathways. But the SARS outbreak of 2003 was a perfect demonstration of how a global epidemic begins. One man, one hotel room, one night, 16 exposures, 5 continents, a planet's worth of consequences, traced backward through international flight manifests to a single brass-numbered door on the 9th floor of a hotel in Kowloon. The hotel changed the room number. They changed it from 911 to 913, quietly, in the renovations that followed the outbreak. They told curious guests that the original room had been removed during the renovation. This was not true. The room is still there. The walls are the same. The window looks out over the same courtyard. The carpet has been replaced. The bedding has been replaced. The brass numbers on the door have been replaced. But it is the same room. It is the room where the modern era of pandemic respiratory viruses began. And the hotel staff, when asked by tourists who have read about the case, will smile politely and direct them elsewhere, because some doorways are too uncomfortable to advertise. The irony of Dr. Liu Jianlun is that he was, in every other respect, exactly the kind of physician you would want to be treated by. Skilled, conscientious, generous, devoted to his patients to the point of exhaustion. He was not a careless man. He was not a reckless man. He was a tired man who wanted to attend his nephew's wedding, and he made one decision that any of us would have made in his position, and the decision happened to be the doorway that an entire planet's pandemic walked through. There is no monster in this story. There is just a corridor on the 9th floor, and a man with a cough, and a virus that did not need to be invited. A 68-year-old businessman flew home from Bahrain with a cough. He visited 4 hospitals before anyone tested him. His name has been protected in the official records. He is referred to in Korean Ministry of Health documents as Patient 1. He is 68 years old in May of 2015. He is a successful agricultural businessman from the city of Asan, south of Seoul. He has spent the previous 2 weeks on a business trip across the Persian Gulf, visiting Bahrain, Saudi Arabia, the United Arab Emirates, and Qatar, looking at greenhouse technology and meeting with investors. He returns to South Korea on May 4th, 2015. He has a slight cough. He attributes it to air conditioning and jet lag. He goes home. Within 48 hours, his cough has worsened. He develops a fever. What follows is the most precisely documented hospital-acquired pandemic chain in modern medical history, reconstructed in the Korean Ministry of Health and Welfare's final report on the 2015 MERS-CoV outbreak, released in July of that year. On May 12th, Patient 1 visits a small clinic in Asan. The doctor diagnoses him with bronchitis and prescribes antibiotics. He goes home. He does not improve. On May 15th, he visits a second clinic, also in Asan. The doctor takes a chest x-ray, sees pneumonia, and prescribes stronger antibiotics. He still does not improve. On May 17th, he is admitted to Pyeongtaek St. Mary's Hospital, where he is placed in a shared ward with several other patients, none of them in isolation, because no one has yet thought to ask him about his recent travel to the Middle East. He stays there for 3 days. On May 20th, his condition has deteriorated severely, and he is transferred to Samsung Medical Center in Seoul, one of the most advanced hospitals in Asia. By this point, he has been symptomatic for 16 days, has visited 4 separate medical facilities, and has been in close indoor contact with hundreds of other patients, family members, and hospital staff. Only after his arrival at Samsung Medical Center does a physician, finally, ask the question that should have been asked on day 1. Have you traveled recently to the Middle East? Patient 1 says yes. The physician orders a MERS test. The test comes back positive. By that point, the virus has had 9 days to spread through the ward systems of South Korea's hospital network. The contact tracing that follows is staggering. 186 confirmed cases, 38 deaths, more than 17,000 people placed under home quarantine. Almost every single transmission traced back to hospital exposure. Not a single case acquired in a community setting. The virus had used the South Korean medical system as its delivery mechanism. Room by room, ward by ward, hospital by hospital. The economic losses exceeded $8.5 billion. Tourism collapsed. Schools closed. The president was forced to apologize publicly for the failure of the national infectious disease response. Patient 1 survived. He spent more than 2 months in isolation. He recovered slowly. He returned home. He has never spoken publicly about his illness. The Korean government has declined to release further details about him out of respect for his privacy and that of his family. He did nothing wrong. He was a businessman with a cough who went to a doctor, then another doctor, then a hospital, then another hospital, doing exactly what every patient is told to do. The system that failed was the system around him. 4 physicians in a row, including specialists at one of the best hospitals in Asia, did not ask him a single question about international travel. The protocols existed on paper. They were not applied in practice. The doorway that let MERS into South Korea was not patient 1. The doorway was a clipboard with a question on it that nobody bothered to ask. The irony of the South Korean MERS outbreak is the most pointed in this entire gallery. South Korea in 2015 had one of the most advanced medical infrastructures in the world. World-class hospitals, world-class equipment, world-class physicians. And that excellence was precisely what allowed the virus to spread. Because patients with serious illness in South Korea move from hospital to hospital seeking the best possible care, a cultural pattern called doctor shopping that is encouraged by the structure of the national health insurance system. A patient like patient 1 with a worsening respiratory illness would naturally and rationally escalate from a small clinic to a regional hospital to a flagship medical center, picking up specialists at every step. The system was designed to reward that movement. The virus exploited the design. The strength of the network became the speed of the contagion. The lesson of MERS in South Korea is the lesson the world keeps refusing to learn. Infrastructure without protocol is amplification. A great hospital with poor isolation procedures is not a barrier against pandemics. It is a multiplier. Every doorway in that chain of 4 hospitals had a sign on it that should have read, "Ask about travel, isolate suspected respiratory cases, assume the worst until proven otherwise." None of those signs were on those doors. The virus walked through every single one of them. Patient 1 went home. The 38 who died are buried in cemeteries across the peninsula. The system that almost ignored them was reformed. Whether the reforms will hold the next time is a question that has not yet been answered. 6 pandemics, 6 doorways. A railway worker in Bukhara who climbed onto a train. A health commissioner in New York who printed the addresses. A scientist at Walter Reed who saw it coming and could not be heard. A typo on a CDC chart that built a scapegoat for a presidency that would not speak. A doctor in Hong Kong who attended a wedding while sick. A businessman in Asan who did exactly what he was told to do and was failed by the system designed to catch him. Every single one of these stories has the same shape. A person, ordinary or exceptional, makes a decision. The decision is rarely malicious. It is sometimes brilliant, sometimes desperate, sometimes simply human. And the world around that decision either contains the consequences or amplifies them. The virus is the constant. The doorway is the variable. The doorway is always built by us. The doorway is always opened by us, and the doorway, once it has been used, is almost never closed before the next pandemic finds it. We are very good, in this species, at building monuments to the men who built the doorways, the engineers, the commissioners, the administrators, the hotel architects, the hospital planners. We are very bad at building monuments to the patients who walked through them and to the corpses left behind on the other side. There is no statue for the railway worker in Bukhara. There is no plaque on room 911 of the Metropole Hotel. There is no memorial in Asan to the 38 who died because 4 physicians in a row did not ask one question. The next door is already open. It is being held open right now by something we have built and are too proud to look at honestly. A trade route, a laboratory, a factory farm, a migration corridor, a budget cut, a protocol that exists on paper and not in practice, a typo waiting to happen. A wedding someone will attend with a cough. A list of addresses someone will publish for the best of reasons. The pattern does not change because the species does not change. We build the doorway. We forget it is there. The virus remembers. I am Blackwell. The next plague will not surprise the people who have read this list. It will surprise everyone else. Sleep well.